Thank you, Heidi. As Heidi mentioned, my name is Nicole. I'm going to be going over the benefits of these beds being installed in our department. The people that they will benefit are the employees, the employer, and most importantly, the patients. The patients will benefit by a more comfortable place to have their scans done. These beds allow pop-ups to lock into place so patients are supported during the whole test. A lot of these tests take anywhere from a half hour to an hour, so the patients are laying there for a while. If they have something to support them or are able to adjust to their most comfortable state, they'll enjoy the test a lot better. It'll also help with the quality of our scans. If a sonographer needs to use a dropout to obtain a better image, it's a lot easier than trying to tilt the patient around and manipulate to get those images. It'll cause less tech fatigue and overall make the study better. And most importantly, it will increase patient safety. Patient safety is a number one concern for us in our department. These beds allow for patients up to 500 pounds to be scanned on them. The beds go down extremely low, so it's easy to transfer patients over to them, and they include safety rails that are easy to put up and down to reduce patient falls. As far as the benefits to the techs, the employees, this will help us maintain a position that is ergonomically correct. A lot of times we get bent into funny positions trying to get these images in on patients just because we don't have the proper equipment to do so. Work injuries will decrease. About 84% of sonographers experience some type of pain during their career, and 20% suffer a career-ending injury. That's a staggering amount, and this is what people make their careers out of. We want to make sure that ourselves and the rest of our department can stay healthy so we can stay here at this hospital doing our job to the best of our ability. If you look at the diagram I provided in the slideshow, you'll see that neck injuries account for 74%, shoulder is 76%, and back is 58%. If we could get these beds in our department, I think that we could reduce those numbers greatly. Also, the employer, with that amount of injuries to sonographers, we're looking at high workman's comp rates. About 15 billion to 20 billion in direct costs happen from sonographer injuries. This we would definitely be able to bring down. Also, raise morale. Employees appreciate an employer that looks out for their well-being. Personally, we are a 5-person department, and out of the 5 people, 4 have had work-related injuries, 2 have needed surgery, 1 had had a career-ending injury, and all 4 have had to go to physical therapy to correct their ailments. With these beds put in, I think that we'll be able to decrease the number of injuries and help keep everybody happy and healthy. Now Matt will go over the comparison of the beds that we have decided that would work in our department, as well as the cost and our ideas for getting these into place as effectively as possible. Thank you for your time. Here's Matt.